Hello, my name is Brian Wike. Today we're going to be testing kinesthesia of the hand and wrist and then L2 dermatome sharp dull test. I hope you enjoy. First we're going to do the sharp dull test on L2 dermatome. What a dermatome is a specific area of the skin that is correlated to a certain nerve out of the spinal cord, and it's named to where it comes out of, which is this one in particular is L2. Test. So what I'm going to use is a safety pin, very sharp, should elicit some pain, and a Q-tip. Okay. Should be dull on the skin. I'm actually going to be testing L2 with a dermatome, which starts at L2 right around here, wraps around here, and comes right in through the groin. So all the whole time, I'm going to have you close your eyes, okay, and I'm going to ask you to tell me if it's dull or if it's sharp, okay? And just so you know what it's like, this is sharp, okay, that's dull. Okay? Yep. Are you ready?
Ready.
All right.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Dull.
Okay, you get over. In a normal setting, I would check both sides to make sure that both sides had same feeling or same sensation, and make sure there's any different changes. Let's talk specifically what's going on at the nerve level. So what's happening is free nerve cells are picking up the information. They're sending it to the dorsal root ganglia, which synapses ipsilaterally in the dorsal horn on the lamina 1, 2, and 5 of the spinal cord. It decussates immediately at the level of the spinal cord in the anterior white commissure. It moves laterally to the anterior lateral column and ascends to the thalamus, where it synapses with the ventral posterior lateral axon, which then actually sends it to the primary somatosensory cortex, which is the same place as L2. So next I'm going to perform a test for kinesthesia of the wrist and hand. And what kinesthesia is the body's ability to know where or how a piece of it is moving, whether it's moving up or down, left or right. So here you go. I'm going to move your hand up and down, and this is for the wrist and the hand. I'm going to move it up and I'm going to move it down. What I want you to do is when I move it up, say up, and when I move it down, say down. Mm-hmm. Your eyes are going to be closed, so just tell me when I'm moving your hand up and when I'm moving it down, okay?
Okay. Up, up, down, down, up, down, up, down, up, up, down.
All right. Again, in the clinical setting, you want to check both sides to make sure that they both are doing the same thing. Let's go talk about now in the nervous area. So what's happening in the pycniform corpuscles are picking up the information in the joint, sending it in a conscious relay pathway to the dorsal root ganglia, which goes to the fasciculus cuneatus. It goes up ipsilateral to the nucleus cuneatus in the medulla, and then it gets actually synapsed over to the medial lemniscus in the thalamus. It decussates there at the internal acute fiber, and it again synapses with the ventral posterior lateral of the thalamus, and then it goes to the sensory cortex, where it tells what's going on and where. So since it's in the hand and wrist, it would be more superior lateral of the primary sensory cortex. This has been a test of kinesthesia as well as the dull sharp of the L2.